To prepare for surgery, you are required to follow a liquid high-protein diet for 2 weeks before surgery. By following this diet, it helps the surgeon perform your surgery both safely and easily. So what you'll be required to purchase is a protein powder, which gets mixed with milk. So you'll be put on a high-protein liquid diet along with some sugar-free fluids. So I'll provide you with a recipe and the appropriate protein powder to purchase when you come to the clinic. So what I'll ask you to do is I'll ask you to make up your full day's batch, and you'll divide that into 4 servings to have at breakfast, lunch, supper, and an evening snack.
I had to keep focused on the end result to get to surgery. During that time, I still cooked for my family, which every time I cooked that meal for my family, it made me more motivated to keep going with my liquid diet because I knew it was one step closer to what I needed to get to.
In addition to your protein drink, you can have some sugar-free fluids in between. So things like sugar-free jello, broth, some herbal teas, those types of things which we'll discuss. You will also be required to stay on that liquid diet for 2 weeks after surgery. So basically, the diet that you went into surgery on is the same diet that you'll go home on. The main difference though is now you'll be drinking much more frequently after surgery. So if you recall, before I said that you will have 4 servings. After surgery, it's much more frequent because you've got less space. You still have the same fluid needs and protein needs, but you have less space to get it in. So we'll outline that when you come to the clinic. But it's very important that you don't consume any solid food for those first 2 weeks after surgery. You need to let yourself heal. And really the focus is on hydration and protein.
The pre and post liquid diet was a challenge. I remember wondering if I could do it. And then I'd made a commitment and I really felt that it was important that I follow the rules exactly. I didn't cheat.
Then when you come for your 2-week visit after surgery, we'll progress you onto soft, pureed foods. So just to name a few, things like cottage cheese, scrambled eggs, blended soups, Greek yogurt. So really the focus is on protein after surgery because that will become the most important thing. You need it for repair, for healing, you need it to minimize muscle loss and hair loss. So I'm going to ask you, once you've transitioned to soft kind of pureed foods, that you still keep all of those food records. It will become very important. I ask that you still continue to weigh your meat portions on your food scale, use your measuring cups, so that we can make sure you're getting in every gram that you need. And I'll also be asking you to record your fluid intake, because remember, it's really hard to get in that fluid after surgery when you have less space. You have to sip on it, not drink with your meals, those types of things. So I'll ask you to record all of your fluids. When you come at your 6-week visit, we'll progress you basically onto all 4 food groups. So by about 6 weeks after surgery, you should be onto protein, fruits and vegetables, maybe some grains. But again, the priority food will be your protein. Basically what it comes down to is when you have less space in that 1-cup pouch, you have to put that priority food in there first. So just to give you an idea, once you're onto all 4 food groups, this is a smaller plate, and if you can recall, I asked you to start using smaller plates before surgery. So the first thing that will go in that pouch is your meat. The second thing will be your vegetables, and the third thing will be your starch. So most people can consume somewhere around about 2 to 3 ounces of meat, maybe a 1/4 cup of vegetables, maybe a 1/4 cup of starch. But that's an average. Everyone is a little bit different. Another common question that I often get is people will ask me about their tolerance for foods after surgery. They'll ask me, will I be able to eat that afterwards? Or I'm kind of worried that I'm never going to be able to have, certain foods afterwards. And it's kind of hard to say because I do find that the tolerance for different foods really varies with each individual. And I find that it changes a lot over that first year. For example, what you tolerate at 6 months out of surgery, maybe changes at 9 months. So it's a lot of learning that whole first year. But I can tell you that most of our patients really do enjoy a wide variety of foods. It's just their portions are much smaller. But I do like to always let you know what are the most common things that I hear, because I see a lot of patients after surgery, and I always like to kind of give you almost a bit of a heads up about the common things. And the most common foods that people tend to not tolerate as well after surgery are breads, rice, pasta, and red meats. Those are pretty common. Red meats are just kind of tough to digest in that little small pouch. And remember, it's absolutely critical that you're chewing your food very, very well. So even before surgery, we'll talk about those common intolerances after surgery and maybe come up with some ideas about what can we do differently. Instead of choosing certain foods, what are some better alternatives? And then when you have surgery, you're well prepared. You've got some other options available.
I eat a wide variety of foods now. I'm not able to eat bread, and I think that's fairly unique to me. Other people are able to do that. I think that my diet is close to normal. I'm only able to eat small portions.
Again, we'll talk about hydration. I mentioned that a little bit earlier. I'm going to ask you again to record all of your fluid intake. I'm going to ask you also to maybe even get a water bottle that you know is roughly about the same amount. So for example, this one that I have is about 3 cups. So I would know that I would have to finish at least 2 of those a day. So something to kind of help you gauge. And again, really valuable thing to put in your food records. You're also required to take lifelong vitamin and mineral supplements with both surgeries. So what is standard with both surgeries, especially in the beginning or for the first 6 weeks, you will be required to purchase a chewable multivitamin. So it looks kind of like this, basically a chewable tablet, no gummies. And I'll advise you when you come to the clinic as to which one. You will also need a liquid calcium supplement. So in the beginning, your supplements need to be in chewable and liquid form. And then after about 6 weeks, we can talk about transitioning you to other forms if you wish. But the point is, lifelong, you will need both supplements. You may also need additional vitamin D, B12, or iron. Those are really common things, and we'll discuss that when you come. So just to recap, before surgery, you're required to follow a liquid protein diet. So 2 weeks before surgery is your protein drink. You'll also be consuming that for 2 weeks after surgery as well. And then we're going to move you on to soft protein-based foods. And then at about 6 weeks post-surgery, we'll move you on to all 4 food groups. But again, protein is the most important thing. You'll be asked to track that in your food records. You'll be asked to track your fluid as well, and take your vitamin and mineral supplements lifelong. I also want to take a moment to say, you will find that every program will do things just a little bit different. You'll see that there are many variations between the pre-surgical diet and how we transition you to foods after surgery, the transition to solid foods, supplementation. You'll find that may vary a little bit from center to center. But at our clinic, we follow what's most current and what's most suggested in the literature and what's most common practice. So again, having bariatric surgery requires a lifelong commitment. It's a commitment to staying active, to keeping your food records, to taking your supplements, and to making healthy food choices lifelong. Because remember, when you have that small space, you need to make every bite count.